I'm Dr. Mahootchi. Let's talk about the risks, benefits, and options for cataract surgery at our practice. A cataract is a yellowing of the natural lens in the eye, or really any way that it becomes less clear and causes blurry vision. When that blur interferes with doing the things you want to do, it's time to consider cataract surgery. You have several different options, so we're going to talk about the main ways we do it here at the Eye Clinic of Florida in 2026. The surgery is overwhelmingly safe and successful. For cataract surgery with me, you have a 99% chance of seeing better with no issues. You have less than a 1% chance of being the same, being no better or no worse, or having minor issues that usually resolve in a short time. You're more likely to be in this 1% group if you smoke, have uncontrolled diabetes, or if you have untreated macular degeneration. Your chance of being worse, if you add all the bad things together, is less than 1 in every 2,000 cases. Your chance of infection, for example, is less than 1 in 15,000. When you arrive at our surgery center, we will give you medicine to relax you. We'll do anything that we need to do to keep you relaxed, safe, and comfortable for the procedure. Most patients prefer not to have an IV. 98% have just 2 drops of medicine placed under their tongue, and they're happy and relaxed during the surgery. Of course, there are many different ways to keep somebody relaxed and comfortable, and we generally are able to work around any level of anxiety. You'll absolutely need a driver to take you home. The surgery itself takes only a few minutes. Total time at the center is typically less than 90 minutes. There are a couple of very important ways that we deliver the best outcomes to you and avoid unnecessary costs. We do things differently. Most places write for 3 different medication eye drops that you take 4 times a day. Some competitors use about 300 to 400 drop doses after surgery. Here, we either use no drops or just use 1. If we use just that 1 drop, it's only once a day, for about 10 days. We call it going dropless. Doing it that way gives you dramatically less dry eye, dramatically less chance for infection, and leaves more money in your pocket where it belongs, and where you can use it for something more meaningful, like a better lens implant. When we do cataract surgery, we remove the cloudy natural lens in your eye and replace it with a clear man-made lens implant. When we do that, we can incorporate the power of your glasses into the lens implant to reduce your dependence on glasses afterwards. Cataract surgery not only clears the vision, but happens to be the best and least expensive way to reduce your dependence on glasses. The lens implant choice decision is one of the most important decisions that you will make, so let's go into the details. With a standard lens implant, if you don't have a lot of astigmatism, your vision can be very good without glasses. But you'll absolutely positively need glasses for reading up close, or at that intermediate distance for the computer or dashboard. If you do have significant astigmatism, you will need glasses at all distances. The standard lens implants are covered by insurance. The following upgraded ones are not. But we make them affordable. Astigmatism. Not everybody has enough astigmatism to worry about, but many do. If you have significant astigmatism, you will need glasses at all distances if you choose a standard implant. The standard lens implants are covered by insurance. Astigmatism-correcting implants are not covered by insurance. The cataract surgery is covered, however. It's just the upgrade to the better technology lens that isn't. The following upgraded ones are not covered by insurance, but again, we make them affordable. In 2026, there is absolutely no reason to pay extra for laser to correct astigmatism or to use a light adjustable lens implant. The modern lens implants can cover almost 99% of astigmatism worth correcting. Even better, the newest versions of those implants correct distance and arm's length vision for over 98% of patients. Also, with the newer astigmatism correcting implants, our taller patients have about a 50% chance of being independent of glasses, even for near. Women over 5'8" and men over 5'11" almost never need glasses for anything with this type lens implant. Astigmatism correcting lens implants are not covered by insurance, but they are included in our intermediate package, which is only a $1,100 upgrade per eye. By comparison, these upgrades are $2,000 to $3,000 or more elsewhere in the Tampa Bay area, with other implants that don't give much more than distance vision only. The next category of upgraded lens implants aim to improve distance, intermediate, and near vision without glasses. These are the FDA-approved presbyopia correcting lens implants like Envy, Odyssey, PanOptix Pro, and the Fine Vision HP. There are others as well. Almost all have astigmatism correction built in. That again means absolutely no need for additional laser. The benefit is being less dependent on glasses nearly all the time for many, many years, if not for life. This is a big deal. No more worrying about where you left your glasses. There are others as well. Almost all have astigmatism correction built in. That again means absolutely no need for additional laser. The benefit is being less dependent on glasses nearly all the time for many, many years, if not for life. It perhaps also means less chance of falling as you get older. These lens implants are only $20 to $50 per eye with us. We are still thousands less for the exact same or better technology, lens implants, and outcome. However, multifocal lens implants aren't one size fits all. There isn't one that works for everyone, so it's great that we have options. Different jobs, hobbies, and even patient height and gender play a role in which type of lens implant I recommend. Our practice has access to every type of lens implant. Unfortunately, many surgeons don't. Their surgery center or employer often restricts their access to variety, and that's very bad for choice. Thankfully, we don't have that problem. Most people with premium lens implants have no issues afterwards. For those who do, the most common side effect is difficulty with night vision, particularly with red lights. This usually gets better with time. Very, very few are bothered enough to wish for a different replacement lens implant. Over the last 20 years, the improvement in technology has made this side effect much less common and much less bothersome. If you are that 1 in 15 who is bothered with night vision at 3 weeks after surgery, you have a greater than 80% chance of not being bothered with just a little time. If we operate on the non-dominant eye first, you are less likely to be bothered significantly. You have the option to use a different lens implant in the dominant eye if you want to try something else. Again, 90% of patients want to use the same implant for the second eye. The chance of you being bothered by presbyopia correcting lens implant side effects so much that you want it out is less than 1 in 500. Almost everyone appreciates their reading vision more than any nighttime or dim light issues. Again, most have no issue with driving at night. Those with lots of floaters, macular degeneration, or moderate to severe glaucoma, droopy lids, and a few other things do better with the intermediate package or standard lens implants. I think the secret to our success is actually checking how you like things a few weeks out. Most places schedule the other eye before knowing the results of the first eye. That's a mistake with the upgraded lenses, in my opinion. Making sure you have the very best vision for life is our goal. That's generally why you see our reviews being so good online. If you have any other questions, please feel free to contact us. This is really about the process at the Eye Clinic of Florida. This does not apply to any other physician or their process. We welcome you to join our community of satisfied patients. If you'd like to learn more, check out our website, seebetterflorida.com, or call us at 813-779-3338 to make an appointment.